Good afternoon. I call this meeting to order. A quorum is present. Without objection, the chair is authorized to declare recess at any time. And pursuant to Committee Rule 4 and House Rule 11, Clause 2H4, the chair announces that he may postpone further proceedings today on the question of approving any measure or matter or adopting an amendment on which a recorded vote or the yeas or nays are ordered. Committee procedures for remote hearings remain the same. If you are experiencing connectivity issues, please make sure you or your staff contact our designated technical support so those issues can be resolved immediately. If you wish to have a document inserted into the record, please ask for unanimous consent and have your staff email the document to veteransaffairs.hearings@mail.house.gov. And previously unfiled amendments should be submitted there as well. Does any member have a question about the procedures for today's meeting? I'm looking and I do not see any hands raised virtually.
Okay, I'm just going to show my face.
All right. I now recognize myself for an opening statement. This committee has a solemn duty to ensure that VA cares for all those who have borne the battle. Caring for veterans must include alleviating and preventing physical and emotional suffering. It also means working with veterans to help them create lives that are not only free of suffering, but full of meaning, purpose, and joy. This afternoon, I am pleased the committee will advance two pieces of legislation that will support veterans' well-being and support the VA nurses and physician assistants who play such key roles in delivering veterans' health care. This legislation is even more critical in the context of the ongoing pandemic. Now, we originally planned to mark up these two bills 2 weeks ago, but a winter storm and change to the House's vote schedule caused us to postpone this business until today. I want to thank Representative Underwood for introducing HR 5575, the RAISE Act, which is the top priority for VA Secretary McDonough to address workforce challenges at VHA. This bipartisan bill will help VA offer more competitive salaries to registered nurses, advanced practice nurses, and physician assistants in high cost of living markets. For months, my staff has worked with Representative Underwood, VA, and the minority to craft this legislative solution for VA in a bipartisan fashion. We reached that point and an agreement from the ranking member on the very text presented in the ANS today prior to scheduling this bill for markup. For reasons I will elaborate on later in this proceeding, I am disappointed that ranking member Bost and Representative Roy decided at the last minute to offer their amendments to the RAISE Act. This amendment not only undermines the bill's intent, which is to improve VA's ability to recruit and retain nurses and physician assistants in increasingly competitive markets, but they politicize the health and safety of veterans and VA employees, and that is something we cannot allow. The VA Nurse and Physician Assistants RAISE Act is not just a priority for Secretary McDonough. It has been endorsed by numerous veterans service organizations and healthcare professional associations, including DAV, VFW, PVA, the American Legion, the Nurses Organization of Veterans Affairs, the Veterans Affairs Physician Assistant Association, the American Nurses Association, the American Academy of Physician Assistants, and others. Now, I will save further commentary on the minority's amendments until later in our proceedings. For now, I'll just say how unfortunate it is that the ranking member and Representative Roy have chosen to waste precious time indulging in extreme libertarian fantasy and vaccine skepticism couched as an attempt to protect individual rights. The American people understand that requiring vaccines for VA employees is an effort to protect sick, elderly, and vulnerable veterans. I was disappointed to see this same indulgence at the Supreme Court when these ideas fly against the common sense view that we have an obligation to veterans. And I'm frankly aghast that my colleague from Illinois is aiding and abetting this extremist ideology. However, This stands in stark contrast to the second bill on our agenda, H.R. 6411, the Strong Veterans Act of 2022. Ranking Member Bost is an original co-sponsor, and we have been working on this package for many months with input from our Senate Veterans Affairs Committee colleagues, veteran service organizations, and mental health groups. And I am pleased with the support that we have seen for it. So thank you. And with that, I now recognize Ranking Member Bost for any opening comments that he may have. Ranking Member Bost.
Thank you, Mr. Chairman. I hope we can soon say that setting side by side in a hearing room, but I'm pleased to be here with you on our committee and colleagues to mark up these two measures before us today. Preventing veteran suicide and helping hardworking VA staff are two priorities of mine. The pandemic and the disastrous Afghanistan withdrawal and rising inflation has made addressing those priorities harder than ever, but also more important than ever. Now, that's where the Strong Veterans Act and the RAISE Act come into play. And, I'm proud to introduce the Strong Veterans Act alongside with the chairman 2 weeks ago, and that's the right thing to do for veterans who are struggling with thoughts of suicide. I have to acknowledge, however, that the Strong Veterans Affairs Act is a very expensive proposal. CBO preliminary estimates are that the Strong Veterans Act will have discretionary costs totaling hundreds of millions of dollars over 5 years. I have said it before, and I'll say it again. Our work must be fiscally responsible. This country is drowning in debt. We cannot keep trying to hand our future generations more than they can pay for. That is not what veterans fought for. And these are their tax-paying dollars too. That is why I would normally oppose a bill with such a high cost unless it had an offset or otherwise addressed. I'm choosing not to do that today for two reasons. The first is urgency and importance of our work on veterans to stop veteran suicide. The second is because the Strong Veterans Act is part of the work the chairman and I are doing alongside with our Senate colleagues to come to a bipartisan, bicameral, fiscally responsible agreement on an omnibus bill for veterans to send to the president's desk that will receive the signature of the president. We still have a long way to go for that goal. Negotiations are very much ongoing. One major factor still under discussion is how to pay for all of the good work we would like to see signed into law. Reporting the Strong Veterans Act out of committee today will allow us to continue to discuss it as part of a larger omnibus negotiation. I am committed to maintaining fiscal responsibility as we make decisions after today's markup about moving legislation on the House floor. Mr. Chairman, our staffs have already discussed this and I hope to get, if I can, to get your assurance that we will be working together to account for higher costs of the Strong Veterans Act as it moves forward in this legislative process. And I'm hoping that I can get that commitment.
Does the gentleman yield back?
No, I was asking you a question. If we can agree that we're going to work together on that.
Well, as said, we are working on the Four Corners Agreement, and I'm sure we will look at cost as part of a final Four Corners Agreement.
Well, I thank you for that. The other bill that's on the agenda is the RAISE Act. The RAISE Act would raise the salary cap for the VA nurses, physicians, and PAs. Nurses and PAs have performed life-saving work for veterans during this pandemic. They have gone above and beyond during this incredible, difficult circumstances. Instead, I stand wholeheartedly in support of them. And I would love to support the RAISE Act today on their behalf. Secretary McDonald called me personally a few weeks ago to advocate for the RAISE Act. He told me that the RAISE Act, we will help VA be a more competitive employer, particularly in rural areas like that many of us represent, and in high cost areas as well. And it will help ensure that VA medical facilities remain well staffed to be cared for and vaccinated and are for veterans across the country, which is critical concern given the staffing challenges that the VA healthcare system, along with every other healthcare system, is facing right now. And I appreciate the honesty, his advocacy, and his forthrightness. But I cannot reconcile the need to pass the bill to help VA hire more healthcare workers at the same time as when VA is preparing to fire potentially thousands of those same healthcare workers for not complying with COVID-19 vaccine mandate. If VA staffing challenges are so dire as to require the secretary to personally advocate for quick passage of the RAISE Act to help VA recruit and retain staff, then VA should not even be considering firing a single VA employee for not getting the vaccine. Now, I support vaccine for anyone who wants it. I myself am vaccinated, but I don't support mandates. And I especially don't support them when there's a lead staff shortage, especially one that could put veterans at risk unless extraordinary action, in this case, quick passes of the RAISE Act, is taken. VA can't have it both ways. Congressman Roy and I will offer amendments this afternoon to address our concerns about the conflicting messages that VA is sending surrounding the vaccine mandates and the RAISE Act. Now, I hope the chairman allows us to debate our amendments, and I hope that they are adopted. And I hope that the chairman will also understand this is not a radical position. This is a very clear position, and we may disagree on this issue, but saying that we are chasing some kind of radical extreme situation when our own president has said vaccines do not stop the spread. Vaccines do not stop the spread. They protect the person that receives the vaccine. We have all said we need to follow the science. That's the science. We will debate this as we go on, and I appreciate the chairman's position. I hope that we can keep it to the issues, not make sure we don't go down a path of directing it towards maybe a personal issue or anything like that. I really hope that you understand our position on these, and I look forward to the debate. And I yield back.
I thank you, Ranking Member Bost. I now call up HR 5575. The clerk will please designate the bill.
HR 5575.
The text was circulated in advance pursuant to committee rules without objection. The first reading is dispensed with, and the bill is considered as read and open for amendment at any point. I recognize Representative Underwood to offer an amendment.
Mr. Chairman, I have an amendment in the nature of a substitute at the desk.
Clerk will designate the amendment in the nature of a substitute.
Amendment in the nature of a substitute to HR 5575.
Text was circulated in advance pursuant to committee rules without objection. The reading of the amendment is dispensed with, and the substitute will be considered as original text for the purpose of amendment. Ms. Underwood, you are recognized for 5 minutes in support of your amendment.
Well, thank you, Mr. Chairman, and thank you for including my bipartisan bill, the VA Nurse and Physician Assistant RAISE Act, in today's full committee markup. The need for this bill could not be more urgent. As we confront Omicron-fueled surges across the United States, we are seeing glaring healthcare workforce shortages that could leave patients without anywhere to turn to for care, whether for COVID-19 or other illnesses. And with record levels of burnout, the situation could get even worse in the coming months. A December 2021 survey of healthcare professionals found that 2 in 5 nurses plan to leave the profession altogether within the next 2 years. These trends are especially pronounced at the VA, where recruitment and retention of nurses and other healthcare professionals was a significant challenge even before the COVID-19 pandemic. According to a September 2020 report from the VA Inspector General, nursing occupations have had the highest levels of severe staffing shortages within the Veterans Health Administration every year since 2014. These shortages have real consequences. The VA Inspector General has called the department's staffing shortages, quote, a root cause for many of the problems in veterans care. We must take action now to ensure the VA can recruit and retain the clinical workforce that the department needs to provide our veterans with timely, high-quality care that they have earned, no matter where they live. That's why it's so critical that our committee advances the VA Nurse and Physician Assistant RAISE Act, which I introduced in October with Representative Dave Joyce, the co-chair of the Congressional Nursing Caucus. This bipartisan bill, which is based on proposed legislation from the VA in their fiscal year 2022 budget submission, would amend the department's pay limitation policy for advanced practice registered nurses, physician assistants, and all other registered nurses. By increasing the pay limitation for the VA's advanced practice registered nurses and PAs from level 4 of the executive schedule to level 1, and from level 4 to level 2 for all other registered nurses, the VA will be able to attract and retain top talent who currently can make significantly more money in non-VA health systems. Increasing these pay limitations is the right thing to do for healthcare professionals who make such enormous sacrifices to care for those who served our country. And it's also a critical step to ensure that our veterans have access to the high quality care that they deserve from the very best clinicians our country has to offer. As a registered nurse, I am proud to be leading this bill on behalf of the VA's nurses, physician assistants, and the veterans they care for. I am glad to have the support of the American Legion, Veterans of Foreign Wars, Disabled American Veterans, Paralyzed Veterans of America, Nurses Organization of Veterans Affairs Physician Assistant Association, and other VSOs. The VA also strongly supports the language in my ANS. And Mr. Chairman, I ask for unanimous consent to submit for the record a letter from VA Assistant Secretary Patricia Ross expressing support for the RAISE Act, which the Assistant Secretary called a top priority for the VA and their workforce on the front lines of this pandemic.
Without objection, so ordered.
Well, thank you, Mr. Chairman. I urge my colleagues on both sides of the aisle to support this amendment in the nature of a substitute and my important bipartisan legislation. And I yield back.
Thank you, Ms. Underwood. I urge my colleagues to support HR 5575, the VA Nurse and Physician Assistant RAISE Act as amended, and this amendment in the nature of the substitute. This bill will improve VA's ability to recruit and retain nurses and physicians, especially given pandemic burnout and increased competition between VA and the private sector employers. This is the right thing to do, and frankly, it's long overdue. Is there further debate on the Underwood amendment in the nature of a substitute? Is anyone seeking recognition?
Mr. Chairman,
Mr.
we got
Roy,
an amendment at the desk.
You're recognized. The clerk will designate the amendment.
Amendment to the amendment in the nature of a substitute to HR 5575, offered by Mr. Roy of Texas. At the end,
The text was circulated in advance pursuant to committee rules. Without objection, the reading of the amendment is dispensed with. Mr. Roy, you're recognized for 5 minutes in support of your amendment.
Yeah, Mr. Chairman, first of all, I appreciate the opportunity to offer it, but it's just the course of doing our job here on committee that we're offering amendments, trying to improve the bill and have conversations about issues that we think are fundamentally important to the issue at hand. That's what committees are supposed to do. I wish we did it on the floor of the House, actually offer amendments and debate on the floor of the House. I would also note that we talk about this long list of supporters of the bill. Well, of course, everybody's saying they support more pay for nurses and doctors. Who doesn't when forced with that question? But what about the question of the fact that the VA has spent about $1.5 billion of the $17 billion that was in there with respect to the CARES and ARP funding? And so why can't some of this funding come from maybe additional dollars? I think we ought to at least have that debate and discussion about where the money's coming from. But putting that aside, the issue that we're raising at the moment, the ranking member and myself, about the issue of the vaccine mandates and the impact that that's having on workforce is directly germane to the question at hand about what we're saying that we need to desperately fund in order to have a sufficient workforce to provide services for our veterans. And what we've got is the reality that we don't have a workforce issue if you still plan on firing thousands of healthcare workers. Like, why is the VA going to proceed with continuing to have these vaccine mandates that would require a lot of our healthcare workers to be removed from the ability to serve at the VA, and then come back and say, we need to have a whole lot more money to hire people to replace the people that you're saying you're going to fire, because they might make a choice to say that they want to make sure they're caring for themselves. And I understand that the chairman said this is politicized. He's right that this vaccine issue with respect to the virus has been politicized, deeply politicized, and it shouldn't have been from the beginning. But the fact is, we're sitting here having politicized the virus, and now with vaccine mandates that the court rightly ruled unconstitutional with respect to the OSHA rules, that should have ruled unconstitutional with respect to the CMS mandates. And now we're sitting here as a committee deciding whether or not we need to provide additional resources to fill the gap. The fact is, the CDC director, Walensky, said on CNN, the vaccines can't do any more is prevent transmission. We know that this isn't about science. Look, which the VA follows the CDC. They made clear that when they shortened the quarantine window to 5 days for healthcare workers, that would allow healthcare workers to return to work, even if they are still COVID positive. You have healthcare workers that are going back in to serve with COVID because of a refusal to allow people to work that have not been vaccinated. We see that right here in DC with the stupid rules in DC, where a restaurant is open and they want to allow somebody to come in. And if you show that you've been vaccinated or that you've tested negative, you can't come in. But then with a vaccine card, you're not allowed to. It's unbelievable the conflict that we've got going on here with respect to healthcare. Look, the issue here is we've got risks, known risks, where you've got Kaiser Permanente, who's got a report that's been out talking about myocarditis risks. Another report that's out saying that you've got a 44 per million incident of hospitalization under the vaccines, but a 377 per million incident of cardiac arrest if you take the vaccines. This is what we're facing is a whole lot of misinformation. And then we're accused of saying that we're going to be the ones that are chasing, what did the chairman say? A libertarian fantasy. Well, I mean, forgive me for wanting to say that if you're a healthcare worker in San Antonio, Texas, that you have the ability to go in, carry out your livelihood without the government using the power of government to say you must be vaccinated to come in and do your job when there are known questions about the vaccine, when the very federal authorities forcing them to be vaccinated are the ones now saying, hey, the vaccine doesn't do anything to stop the transmission of the disease. And then you say, oh, sure, come on in if you're COVID positive a few days after you had COVID. But no, if you haven't been vaccinated, you can't come into work to serve the great veterans of this country. That makes absolutely no sense. There is no reason why we should be sitting in here taking a whole bunch more money to dump into trying to go attract people to work when we've been destroying the marketplace, where we've been pulling people out in hospitals across the country, where we see a massive reduction in the availability of healthcare workers because of a misguided policy that the chairman is right about one thing, has been deeply politicized. I stand with Chairman Bost that we should have a deeper discussion about this and that we shouldn't have the vaccine mandates in place and that we should restrict that. And that's why I think we should have a vote on this amendment. And I hope the chair won't rule it out of order and that we should actually have a vote on the substance. I yield back.
Thank you, Mr. Roy. Thank you for presenting your amendment. We will be discussing. I have no plans to rule this out of order. However, I must strongly oppose your amendment. This amendment would undermine VA's most important obligation in providing care to veterans, which is to protect their health and safety. This amendment is a political stunt that injects extreme ideological views into the very serious work of this committee. It has no place being directed at a healthcare organization that serves a population as medically vulnerable as veterans. The veterans in VA care are on average older and sicker than the population served by private sector healthcare systems, and they are at significant risk of harm from COVID-19 infections. VA's employee vaccination mandate is one of the most important tools it has for keeping its patients and employees safe. VA is not at all out of step with private health employers' decisions to institute mandates for their healthcare workers or with the mandate that applies to providers at federally funded healthcare facilities. Mr. Roy, it is apparent from your recent social media posts and statements that extremist libertarian viewpoints and vaccine skepticism are ideologies you have chosen to promote. But it does nothing to improve the lives of veterans. And to this point, just in the last few days, you have amplified fictional rumors that Canadian Prime Minister Justin Trudeau fled to the United States to avoid protests from Canadians opposed to vaccine mandates. Let me be clear. This is disinformation, your disinformation. And your disinformation and games have no place in this committee. Furthermore, based on the way your amendment is written, VA would incur significant increased costs to mitigate additional COVID-19 infection risks that would be presented due to fewer employees being vaccinated. We are here today dealing with serious legislation that will have a direct impact on supporting the healthcare workforce that cares for our nation's veterans. And as of today, 19,336 veterans and 249 VA employees have died of COVID during this pandemic. I say to the committee and everyone listening today, patient safety at VA is a non-negotiable issue with me, and I have no patience for this type of partisan stunt. Even our very conservative Supreme Court upheld President Biden's vaccine mandate for healthcare workers. The science shows that vaccines slow the spread of the virus. Mr. Roy, I dispute your characterization of the federal mandate as a bureaucratic edict. Vaccine mandates are not new. They apply in the military and at schools in every state of the nation. There is nothing bureaucratic about saving veterans' lives. And I would go further and say it is morally right to take the step of vaccination to protect veterans. Not allowing VA to uphold the same workforce standards as the private sector healthcare system would make veterans second-class citizens to the protections afforded to the general public receiving care at other facilities that receive federal funds. I therefore strongly urge my colleagues to oppose this amendment. Is there further discussion on the Roy amendment in the nature of a substitute?
Mr. Chairman.
Ranking Member Bost, you are recognized for 5 minutes.
Thank you, Mr. Chairman. I fully support Congressman Roy's amendment, and I thank him for offering it. I believe Secretary McDonald when he tells me that he is concerned about staffing levels at the VA facilities. I am too. That's why I cannot support the VA healthcare workers losing their jobs for no other reason than not having been vaccinated against COVID-19 in compliance with the administration's heavy-handedness. My understanding is that approximately 36,000 VA employees have filed exemptions for vaccine mandates, either for religious or health reasons. No VA employee has been fired to date for not complying with the vaccine mandate. That's a good thing. VA has not responded to many questions I've sent about the vaccine mandate, and will in advance of today's markup, well in advance of today's markup, to help reconcile and supporting the underlying bill. Supporting this bill while firing all are still 36, as many as 36,000 employees who have filed the exemptions would be hypocritical and frankly silly. I want to believe that the secretary, when he tells me that he is worried about not having enough nurses and PAs to care for the veterans, that is why he needs to raise the RAISE Act to pass. If that's true, the case, then I would hope that we would be right there with him and not willing to allow these employees to be released because they didn't take the COVID vaccine. The stakes are simply too high. This is not a political position. This is we in this House have been watching this go on, and what we've said is follow the science. The administration themselves has said that the vaccine does not stop the spread. The vaccine does not stop the spread. And as far as the statement of the Supreme Court, they chose not to rule one way or another. Not to rule. They chose not to. They ruled on another issue, but they did not rule on this issue. And they just chose not to take it up. I hope that every one of my colleagues can support Roy's amendment, and we also need to know and understand this is not a partisan issue. This is a case where we have talked to the secretary. Whenever I first talked to the secretary, were there going to be the options for the health issue and also the religious issue? He said yes. Those are amendments put out there. Now we're moving forward with this, and we're saying we want to keep staffing. We want to keep staffing too, and we want to keep and to claim it's unsafe to allow these people to work when we know what the science is. This amendment is a good amendment. It would allow for us to make sure we're doing what this bill is exactly doing, which is trying to make sure we keep staff there that have done nothing wrong except choose not to take a vaccine because of questions in their personal lives. And with that, I yield back.
Thank you, Ranking Member Bost. I now recognize Representative Underwood for 5 minutes.
Well, thank you, Mr. Chairman. I strongly oppose the Roy Amendment and encourage every member on this committee to do the same. So let's start with some facts, colleagues. COVID-19 vaccines work. They've been proven to be safe and effective in clinical trials. They've been saving lives all across the country for more than a year. In fact, recent research published in the Journal of the American Medical Association found that compared with a no vaccination scenario, the COVID-19 vaccination effort saved more than 240,000 American lives between December 2020 and June of 2021 alone. The data are clear. COVID-19 vaccines work, and so do the VA's vaccines requirements. Secretary McDonough recently reported that 99% of the VA's healthcare workforce has now been vaccinated or sought an exemption, including 37,000 employees getting at least their first shot since the department's requirement was announced. So we know that COVID-19 vaccines work, and we know that the VA's employee vaccination requirement has made an impact, protecting not only the VA's healthcare workforce, but also the veterans they care for. And ultimately, that's who's threatened by this amendment, our veterans, the very same people who were willing to put their lives on the line for our country and are now dying in VA medical centers here in the United States from a virus that we can protect against. That's why this amendment is opposed by the VA Physician Assistant Association, the Nurses Organization of Veterans Affairs, and the American Academy of PAs. 24 hours ago, the minority gave every indication they were going to support the RAISE Act. They know how desperately the VA needs this flexibility to offer competitive salaries to nurses and physician assistants. But at the last minute, we see late amendments filed to derail bipartisan progress on a desperately needed bipartisan bill. And all the while, it's our veterans who suffer. It's our veterans who will go into a VHA facility and not receive timely care in the middle of a pandemic. Our veterans deserve better. The healthcare workers who care for our veterans deserve better. I urge every single one of our colleagues to pick sides on this vote. Vote with veterans, vote with nurses and PAs, and reject this anti-science, anti-veteran amendment. Thank you, and I yield back.
Thank you, Representative Underwood. I now recognize Representative Rosendale for 5 minutes.
Thank you, Mr. Chair. We were promised that the introduction of the COVID-19 vaccines would lead us to herd immunity and free us from the grips of the COVID-19 pandemic and our response to it. However, 1 year after the emergency authorized vaccines were administered, despite 87% of the adult population being vaccinated, the virus continues to spread without much regard for our vaccines. In fact, the only rules that this virus seems to observe are those of seasonality and of natural immunity. But still, many Americans are subject to the continued COVID-19 precautions, often imposed by unmasked hypocrites that have been shown to be completely ineffective in even slowing the virus down. And as if it weren't bad enough that children have to mask up for the safety of us adults, their parents are now threatened with joblessness if they don't comply with these mandates. 2 years into this pandemic, anyone who has been working in healthcare during the pandemic by now has been exposed, which means per recent CDC studies, no less, that they have greater protection from the virus than those that have even been vaccinated, which further means that these are exactly the people you want working in healthcare facilities, not firing them. This has been happening in every health system, but the VA in particular is not well positioned to lose staff. Thousands of healthcare workers who were lauded as COVID heroes have now been fired over these mandates, even as we're told that hospitals are beyond capacity. What is the case to require healthcare workers, of whom we are in desperate need, to receive a vaccine against an extinct variant, and that has little to no ability to stop the spread of the virus? There's no need to require vaccinations, but there is great need for our healthcare workers. I urge all of my colleagues to pass this amendment. And Mr. Chair, I would yield the balance of my time to my dear friend, Representative Roy.
Thank my friend from Montana. Mr. Chairman, how much time do we have left?
It's this is not an order. We'll move to the next speaker. I now call on Representative Ruiz.
Mr. Chairman, that if there was time left of his 5 minutes, that is an order.
There's 2 minutes and 45 seconds left on my time.
But Mr. Chairman, is the time now been yielded to me? Mr. Chairman, are we waiting a ruling here, Mr. Chairman?
I will allow the gentleman may yield the remainder of his time to Mr. Roy.
All right. Well, I thank the chairman. I think my friend from Montana. I think we got about 2.5 minutes. And I would just say, if the chairman wants to follow the leadership of Justin Trudeau in Canada, be my guest. I'm perfectly happy to slap around the Canadian Prime Minister for his absolute abject failure and to side with Canadian truckers and those who are standing up for freedom and our neighbors up north of the United States. I've heard a lot of commentary here, a lot of it not true. But we talk about this. Let's consider the fact that when it was mandated, it wasn't even FDA approved. The fact is that COVID is now different, right? We know we're dealing with the Omicron variant of COVID, and that has a much less lethal reality to it. And we didn't even talk earlier about the fact that the CDC has itself now finally acknowledged these months later, all which we were told was a fantasy, a libertarian fantasy, to use the chairman's terms, when we were saying that natural immunity was something that was important for us to consider. Now the CDC, in its infinite wisdom, says, yes, natural immunity can confer stronger immunity than vaccine immunity. So what business is it of the chairman or any other Democrat on this committee, along with the BA secretary, to go in and tell a nurse that nurse can't carry out her profession and then end up hurting our veterans with extended wait times, like the 43 days that my constituent has been stuck waiting for an MRI. And the only reason he can get health care is by going to a health savings account through his private employer. We should be fixing the VA. We should be standing up and doing the things that we ought to do. And yes, I'm fine with having debates and discussions about what the proper pay is for our nurses and doctors at the VA, but we should be looking at the budget we've already spent, and we shouldn't be doing it on top of ridiculous politicized mandates that is hurting care and have no basis in science. I yield back to my friend from Montana.
The gentleman from Montana still has.
Thank you, Mr.
45
Chair.
seconds.
And I would follow that up with our obligation is to make sure that these vaccinations are available, and we have done so, that they're readily available for the veteran population. And we've done an incredible job working together to make sure that that is the case. But it is up to the individuals to make these decisions. We've done so, and I would yield back.
Thank you, Mr. Rosenstein. And before I recognize Dr. Ruiz, I'll just say that no mandates were appropriate, nor were they instituted prior to approval of the FDA. The FDA did approve vaccines for use under a temporary approval, provisional approval. But once they were approved by the FDA, then mandates were considered. Now recognize Dr. Ruiz for 5 minutes.
Thank you, Chairman. As a physician who understands virology and public health, this conversation continues to be distressing, especially with comments that discredit the work of the vaccine and how it actually works. Quotes like "does not stop the spread," quotes like "promised herd immunity and we still have the virus" are so misinformed and shows a very lack of misunderstanding. First, we know that viruses work, okay? When you look at those that are dying and being severely hospitalized in hospitals, this is now a pandemic of the unvaccinated. So the vaccines, let me just repeat it quickly now. The vaccines are to prevent death and to prevent severe hospitalizations, okay? In some instances, especially with the first virus, the alpha virus, there was enough immune protection that it fought an infection from the Omicron. So yes, it did. It helped prevent getting infected. However, the virus has evolved. You had Delta and now you have Omicron. And so the virus continues to learn how to evade immune responses from even the previous natural immunity, because people who have been infected from the alpha got infected with the Delta and is now infected with the Omicron. So even natural immunity doesn't necessarily guarantee that you're protected from getting infected. The goal here is to provide maximum protection. So even if an individual was naturally infected, they will get added protection if they get the vaccine. Vaccines work. Continuing to promote this idea that there was a promise that the vaccine was going to end the getting infected, knowing that there's variants and variants will force us to continue to develop new therapeutics, is just another conspiracy way to politicize this and attack the administration. The second issue is, look, 99% of all healthcare workers are already vaccinated or have received an exemption, 99%. So this is, you're overblowing an issue and magnifying this for political gain. The third point is this. You ask, why are we doing this? Well, when you send a Marine to the front line of a war, you require that Marine has a certain level of physical fitness and that they have a certain level of skills with weaponry, not only for their own safety, but in order to protect their fellow Marines out in the field and others, so that they can function in a scenario in the front lines that they're supposed to function with all safety. Healthcare workers are in the front line of this war against the pandemic. It is the same requirement that they have certain protections like the vaccine in order to protect themselves and to protect others. This is about the social responsibility and caring for patients. That's the reason why we want to make a safe environment so that veterans who are not eligible for the vaccine that go into the VA hospital are able to get the care that they need. Furthermore, this bill, this amendment is definitely a pro-virus and anti-veteran health amendment, because there are veterans who are coming in immunocompromised. They are chronic illnesses. There are veterans who are debilitated, 100% oxygen dependent, who are at most risk of getting the virus, who perhaps are not eligible to get the vaccine. And we need to do everything possible to protect them from getting the vaccine as well. And so I urge all of my colleagues to please let's just do what's right to protect the veterans that visit the VA and diminish the risk of severe illnesses. We should promote the use of vaccines and encourage people instead of discouraging people from getting the vaccine, which we know that works very well. With that, I yield back my time.
Thank you, Dr. Ruiz. Representative Miller Meeks, you're recognized for 5 minutes.
Thank you very much. And I don't need 5 minutes. I just wanted to clarify something Dr. Ruiz said, and that certainly through the Delta variant, the vaccines, and I would agree, they prevent serious illness, they prevent hospitalization, and they prevent death. We were very hopeful that, like other vaccines, the vaccine for SARS-CoV-2 would prevent transmission. But we saw with the Delta variant, studies coming out of Israel, studies coming out of the UK, that it did not prevent transmission. And further, the Omicron variant has showed that it definitely does not prevent transmission. And the studies are that the vaccine is effective for about 30 days, and then after that it wanes. So I think it's the point of having a mandate or mandating a vaccine is to prevent transmission, to prevent infecting other individuals. And if the vaccine is not going to prevent transmission, then I think you have to rethink that process. I'm fully vaccinated. I've given vaccines. I've persuaded people, including young people, to become vaccinated. So I am not in the category that Dr. Ruiz would like to paint some of us, but I think it's important that we should be talking about immunity. And if you want to test antibodies of healthcare workers to make sure they have the appropriate antibody status to COVID-19, that is certainly a way to do this, rather than saying, if you don't get a vaccine, we're going to terminate you, and then we're going to replace you with someone who we're going to pay higher. So I just wanted to make that point, that it was one of the things that was considered in the OSHA ruling by the Supreme Court, is the public health emergency and mandate for vaccines is that there is a reduction in transmission, so it is a public health rationale. And if there's not a reduction in transmission, we should continue to talk about immunity and not talk about, only a vaccine strategy if it does not prevent transmission. So I'd like to see us talk about that, you including Dr. Ruiz, and I think we would get much more buy-in from people and be much more honest about what we're doing. No one is suggesting going to a COVID-19 party in order to get natural acquired immunity. I will continue to encourage people to be vaccinated, but I do think we need to realize immunity can come from different sources. Thank you. I yield back.
Will you yield to me?
Will the gentlelady yield some of her time to Dr. Ruiz?
I've already yielded back my time, Chairman Catano.
All right, that's fine. The answer is no. Are there any other members who wish to be recognized? General Bergman, you wish to be recognized? 5 minutes.
Thank you, Mr. Chairman. I appreciate the recognition. It's been interesting to listen. And with that, I'll yield my time to Mr. Roy.
Well, I thank the general, and I just want to offer a couple thoughts. I appreciate Congresswoman Miller Meeks for her commentary on it, which I would co-sponsor. That's the kind of conversation and dialogue that I think we ought to be having. Recognizing natural immunity, having serious conversations about the impact on our workers, having to make choices, recognizing 99% of the health personnel have been vaccinated, and that we're only talking about a small portion, but they might have a reason, they might have a rationale, and we may end up with then harming actually the care for our veterans when that 1% may not be able to maintain their employment and be able to provide care. That's the reality I think we ought to be talking about. And talking about with respect to, as I pointed out, President Biden last year said, and it was roughly in the nature of, you're not going to get COVID if you have these vaccinations, end quote. Now, I'm not here to pillory the president for having said that, even though I don't believe it was accurate then, didn't believe it was accurate then, and I certainly don't believe it's accurate now based on the science that we have. And I'm not saying anything about the efficacy of vaccines and whether people should get them or not get them. I just think our position as a country should have been much closer to, for example, Japan. When Japan said, we have vaccines, they're highly effective, particularly at preventing people from getting seriously ill, particularly when we're dealing with the first versions of Delta. But there are some risks. We're studying the risks, things like myocardial issues and things that studies are showing some risks in some populations, and therefore we're not going to mandate them. That to me is a very reasonable position for a country to take. And to say that if we're taking that position and that's what we believe the position should be, that somehow that's libertarian fantasy, as opposed to trying to promote a common sense policy whereby American people can make good decisions. And look, my father had polio. He lived with it in 1949, both bulbar and spinal. He's lived with it his entire life. My father has been vaccinated for COVID, and I agreed with that decision. Vaccinated twice, boosted. And I've told people that, and early on in the pandemic, so we should protect the vulnerable. But what I absolutely will fight with every ounce of my being, is whether I'm in Congress or out, is to say that we should not have mandates coming down from the federal government, particularly in areas where they shouldn't be extending, as we saw with respect to the OSHA rules. I believe the extension of CMS as well, that undermines the ability of people for us to come to consensus on healthcare policy. Some of my colleagues talked about about vaccines and mandates that are in place for schools. Almost all of those, if not all, are locally decided, state decided, have significant amount of exceptions for individuals to exercise their liberty, their religious preference, what's in the best interest of their family, take into account their health issues, and even at universities, and that a lot of those exceptions are in place. And usually after these shots have been around for a long time and lots of study. I went back and studied the polio rollout. This rollout has been exponentially faster than the polio rollout. When we saw children dying from polio, children getting paralyzed from polio, parents were scared to death. My grandmother dealing with it as a single mom, but my dad's stricken with polio. So I don't like it when people are saying, "Oh, you're an anti-vaxxer." It's completely unfair characterization when you're simply trying to stand up for the prospect that you should be free to make a decision within the context of the good information that is available in front of us, and the many doctors who are out there saying we now should be looking at and recognizing natural immunity and the ability of individuals to make decisions in their interests, and that will benefit the VA by making sure we don't lose healthcare in a politicized response. On that point, I agree very much with the chairman. And with that, I appreciate the general for yielding to me, and I yield back to him.
We have about 50 seconds left.
I'm very appreciative of the debate that I've heard, because this is what committee work is supposed to be. The only suggestion I would make is next time we do it in person. And I yield back.
Thank you. Gentleman yields back. I now recognize Representative Brownlee for 5 minutes. Representative Brownlee.
Thank you, Mr. Chairman. I wanted to yield my 5 minutes to Dr. Ruiz.
Dr. Ruiz. Brownlee, yield.
Thank you very much, Representative Brownlee. I truly respect the fellow doctor on the panel, and I just really want to emphasize, because I know that there are veterans that are listening, that there are family members of veterans that are listening, that are trying to understand the science and in order to make wise decision that will help protect them and their loved ones from getting severely sick or dying from this virus. Look, the vaccines work. And in fact, the CDC says, and I'm quoting, COVID-19 vaccines are effective and can lower your risk of getting and spreading the virus that causes COVID-19. So this is not an all or none scenario. There's a lot of absolutes that are being thrown out there that the vaccine doesn't stop transmission. Well, when you look at this in an individual patient to doctor case, then a patient is either infected or not infected. But the benefits of having studied public health and understanding population health is you understand that the language we use is in reducing risk for a population. And therefore, if you do, then you reduce the case rate of new infections. If you reduce the case rates of new infections, then yes, you do reduce transmission. So yes, the vaccine helps in reducing transmission. Guys, I'm afraid we're never going to get to a point where we're going to eradicate coronavirus because it mutates rapidly. So this is going to be something that we're going to need to work on, improve our therapeutics, improve our vaccines. I'm fortunate to sit on the Health Subcommittee of Energy and Commerce that we've been working on. But understand this, the argument was made that if the vaccine does not reduce transmission, then the idea that it should not be required as a self-protection and a way to protect our healthcare workers and their patients and other health workers in the front line in this war of the pandemics falls through. Because in fact, the science shows us through public health studies that it reduces the risk of transmissions. Let me explain the science behind this. The Alpha Omicron was able to infect and replicate in a person's body until we had the vaccine. Our vaccine boosted the innate immune response so that it was rapid response. So while the virus was replicating before preclinical levels, the immune response was able to squash it, and therefore they were protected from getting infected. The issue now is that with some Omicrons, depending on the viral load, the amount of viruses that you start off with, they're replicating at a much faster rate than your immune response, either through natural immunity or through the vaccine, is able to respond to in order to prevent the clinical infected status of coronavirus. That's the issue. However, depending on your viral load, yes, indeed, if it's low initially and you have the vaccine and the booster, then perhaps your immune response will be fast enough to prevent a clinical infection. So yes, in some cases, the vaccine does prevent getting infected from coronavirus. So I'm hoping that those that are viewing can understand that the goal here is to receive maximum protection, not only for yourself, but for your family members. And in order to combat the misinformation that's out there, I just wanted to provide some of the clinical basic science explanation as to how this works, so that it's not all black and white, but it's a perspective based on science that will do the right thing for our patients, for Americans, and for our country. I yield back, and I thank the representative for yielding her time to me. I yield back to the representative, Brownlee.
Ms. Brownlee, you have about 4 seconds left.
Thank you, Dr. Ruiz. I would just say, let's get on with it. This is sound legislation needed immediately, and all of the healthcare providers and the VA have vetted this bill. It's the right thing to do. Let's vote aye.
Thank you, Chairwoman Brownlee. I appreciate that. Any other members wish to be recognized?
I have a question. Was that Representative Brownlee voting aye on the amendment? Did I understand?
No, aye on the main bill, no on the amendment.
All right. All right. Any further discussion on the Roy amendment in the nature of a substitute?
Ready.
All right. If not, the question is on the amendment by Representative Roy. All those in favor of the Roy amendment say aye.
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 All those opposed will say no.
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 In the opinion of the chair, the noes have it, and the amendment is not agreed to. Without objection, the motion to
Mr. Chairman,
Mr. Roy.
that's for the ayes and nays.
There is a request for a roll call vote. Is there a sufficient second?
Mr. Chairman, I second.
There is a sufficient second pursuant to Committee Rule 4. Further proceedings on the amendment shall be postponed. Ranking Member Bost, you are recognized.
I have an amendment at the desk.
Clerk will designate the amendment.
Amendment to the amendment in the nature.
Text was circulated in advance pursuant to committee rules. Without objection, the reading of the amendment is dispensed with. Mr. Bost, you're recognized for 5 minutes in support of your amendment.
Thank you, Mr. Chairman. You know, if Congressman Roy's amendment is a big tent, mine is a small umbrella. His amendment would provide a COVID-19 vaccine mandate. It would prohibit a vaccine mandate at the VA. My amendment would prohibit VA from hiring a nurse or a PA at a salary higher than the person that would have been fired because of not receiving the vaccine. So I'm gonna explain that again. So if a person chooses not to take the vaccine, they are relieved of their duties and fired from the VA. The VA cannot hire someone back to replace them at a higher salary than what they were paying to that particular individual at that time. I suspect that many nurses and PAs have made the personal decision not to comply with the vaccine mandate or have filed an exemption to it. So it would be a slap in the face to them from the VA to fire them for not taking the vaccine, and perhaps because it violates their personal religious beliefs or because the doctor told them they really probably shouldn't take it, and then have to see someone else being hired back at a higher rate of pay. My amendment would prevent that from happening, and I hope I can get the support of my colleagues on this amendment. And with that, I yield back.
Thank you, Ranking Member Bost. I must strongly oppose this amendment. I'm disappointed to see this amendment today, frankly. This legislation has been under discussion since last October, when the Health Subcommittee held a legislative hearing on the bill. This late filed amendment is, again, political gamesmanship. The ranking member raised no such concern before our markup when it was originally scheduled for January 20th. But what a difference a snowstorm makes, or in this case, an almost snowstorm. Almost a year ago, the ranking member recorded a public service message with me where he said, quote, "The science shows that the vaccine is a safe and effective tool in the fight to manage the spread of the virus, to protect vulnerable populations, including our own nation's veterans, and to help save lives," end quote. Now he seems to have had a change of heart. And let me invoke the very powerful explanation by our colleague, Dr. Ruiz, from a population standpoint, from a broader standpoint. The epidemiological studies more than amply demonstrate that, yes, the vaccine does reduce the caseload, and reduced caseloads mean less transmission. If we look at it from a systems point of view, I reject the false choice that the ranking member presents with his amendment, that we must either choose to make VA a competitive employer in high cost of living locations or bend to vaccine politics. The ranking member wants to punish VA for removing employees who are refusing the science, employees who have no place caring for our nation's veterans. On top of that, he wants to prevent VA from offering competitive salaries to individuals it would hire to backfill those positions. But let me make myself clear. It is my sincere hope that no employees get fired or dismissed, that because mandates work. We've seen that in private sector companies and many different situations where employers have mandated the COVID-19 vaccine, that we see many employees, the vast majority of those remaining who are refusing the vaccine, to comply. It is my hope that but at least very minimal numbers of employees will find themselves dismissed because of noncompliance. This is about ensuring that veterans receive care safely, not about firing employees. But the only choice this amendment makes is to hold VA nurse and physician assistant pay hostage for political purpose. VA needs more nurses and physician assistants, and this amendment will make it harder to hire them. I applaud the VA providers who have made the personal choice, in my mind, the patriotic choice, to protect themselves and the veterans they serve by getting vaccinated. Undermining all of this with the ranking member's amendment is not appropriate, and I urge my colleagues to oppose it. Is there further debate on the Bost amendment? Mr. Bergman, General Bergman, you seek recognition. I recognize you for 5 minutes.
Thank you, Mr. Chairman. And with that, I yield to Mr. Bost.
And I thank the gentleman for yielding. Mr. Chairman, I think it's vitally important to understand, because it's been said several times. This is not, regardless of how many times you say it, this was not a political move, and that is not playing politics. This is true employees that I am concerned about and others are concerned about on how they will be treated in the VA based on their personal choices. And their personal choices and the question of the science. We've had doctors say both say from different directions that that does not help stop the spread. One says it does, one says it doesn't. So saying you're following the science, and we have experts on both sides of this, is why it was so vitally important to have this debate. And to say that at the last minute we put an amendment in, Mr. Chairman, according to our rules, reason we have amendments and have the opportunity to place amendments at the level that we do according to the rules that we are governed under in this committee, which we applied our amendment through those rules. Because as these discussions go on, sometimes things come up that you realize that it's necessary to then bring that discussion further in. Both of these amendments have done that. It's been the people who are listening to this hearing today have the opportunity to hear. Now, understand, you quoted me from a year ago that I was agreeing with the vaccines. I do. I've taken the vaccine. But that doesn't make it to where we can force these employees. As soon as the VA came out, the secretary called and told me that he was going to do these. I needed to make sure that he was going to allow for those exemptions. And understand, no one has been removed yet. But we want to make sure that this is in law, that those exemptions are followed through for the point of religious concerns, for the point of health concerns, for these points in the freedom that we have in this nation, that if you choose not to take the vaccine, you're not putting yourself in a place where you're going to be removed from your job. And this amendment that I am now carrying is very simple in the fact that it says you also, if you are removed from your job, you're not going to be slapped in the face by some bureaucrat that says, look, we're going to go ahead and pay somebody a higher salary than you because you didn't take the vaccine. Now, I'm going to tell you that these people that are even the 1%, they have not been any reports that they're bad employees or anything like that. This is one issue. It's one issue. It's one issue where they may disagree with having the government tell them they have to have a vaccine that is, one, maybe they don't want it, period. Two, maybe that some doctors told them, here's your problem that is a very big danger, and you have a family history and a concern about taking it. And then the other one, based on their faith, which is something that we in this nation have held to for years and years and years. That Constitution is a very serious document. I know we all raised our hand to it, but you ought to understand that that is our constitutional right. And that's not to endanger veterans. I disagree with some of the speakers that say it endangers veterans by doing this. That's not true. That's not true. It could endanger you by not taking it. That's why I encourage people to take it. But that being said, saying this is political when it is not, this is the debate that is going on this issue. I want to make sure, that's why I signed on with the bill that's early on this bill and supported this bill. But these are simple things that we can put in if we say that we want to make sure the VA can make sure that they're fully staffed with the best staff and keeping their staff while trying to compete in a world where we're having trouble keeping healthcare workers. It makes no sense to throw other healthcare workers who've been doing their job out on our keisters. With that, I yield back.
Gentleman yields back. 9 seconds remain on Mr. Bergman.
I yield back.
Mr. Bergman yields back the remainder of his time. Ms. Underwood, you seek recognition. I recognize you for 5 minutes.
Thank you, Mr. Chairman. I wanted to speak on Mr. Bost's amendment. I strongly oppose, and I encourage every member of this committee to do the same. If the previous amendment could be characterized as anti-science, then this amendment is anti-access, anti-quality, anti-healthcare for our veterans in the middle of a once-in-a-century health crisis. Let's remember why the RAISE Act is part of today's markup. It's because the VA is facing significant challenges in hiring and retaining nurses and PAs to work in VHA facilities. One of the primary reasons why the VA is having such a hard time is because in many communities across the country, the VA can't offer salaries commensurate with non-VA health systems. As a result, there are critical workforce shortages in VHA facilities, and that ultimately means less timely, lower quality care for our veterans. Very simply, my bill would address this issue by ensuring that the VA has the flexibility to offer competitive salaries to nurses and PAs, allowing the VA to recruit and retain the workforce it needs to provide veterans with the care that they've earned. But just as my bill is simple, so is this amendment. Its goal, the actual purpose of this amendment, is to try to prevent the VA from filling vacancies in its workforce. The amendment says that the VA wouldn't be able to offer the competitive salary that my bill makes possible if that nurse or PA is backfilling the position of a VA employee who lost their job due to the department's vaccine requirement. Think about that for a second. Think about who that punishes. It punishes two groups of people. First, it punishes the nurse or physician assistant who signed up to dedicate their career to providing veterans with high quality healthcare. It denies these new VA healthcare workers the chance to make a competitive salary. And second, it punishes our veterans because a nurse or PA who realizes that they could make better money outside of the VA won't come to work at a VHA facility, resulting in a VA healthcare workforce stretched thin and unable to provide every veteran with the care that they deserve. So this amendment punishes nurses, it punishes physician assistants, and it punishes veterans, and it does not help us provide better care. This amendment is also opposed by the VA Physician Assistant Association, the Nurses Organization of Veterans Affairs, and the American Academy of PAs. VA itself has said how desperately they need to pass the RAISE Act without delay and without these anti-science amendments. I urge my colleagues to join me in voting no on this amendment so that we can move on from this political stunt and get back to passing bills to help the people who served our country. Thank you, Mr. Chairman. I yield back.
Thank you, Representative Underwood. Representative Roy, you seek recognition. I recognize you for 5 minutes.
Thank you, Mr. Chairman. I certainly support the amendment offered by the ranking member. I would note, indeed, in agreement with the chairman yet again, what a difference a year makes when everyone on this committee, everybody here in our body in the House of Representatives was lauding and appropriately applauding the heroes of our healthcare system, those on the front lines dealing with the healthcare realities of dealing with COVID. And then here we are today. Note that the phrase I was struck with, offered by the chairman, surrounded by a whole lot of phrases like non-compliance, was this phrase: no place caring for our nation's veterans, end quote, with respect to unvaxxed healthcare workers. You should think about that for a second. You're a nurse, you're a doctor, you've spent your whole life working in service of others, and you had COVID a year ago. And you've got, in your strongly held belief and or antibody test, natural immunity, which, as I said before, and as which Congresswoman Miller Meeks was kind of alluding to, you've got this reality that you could have a stronger immunity than, in fact, getting vaccinated. And you choose for your health and well-being that you believe it's in your best interest to rely on that natural immunity. And then you're being denied because the chairman of the Veterans Affairs Committee or the VA secretary says, quote, no place for you caring for our nation's veterans. Hey, think about that. Think about what we're saying. Think about what that means. What about the 31-year-old father of two, I think? He definitely has a 2-year-old child. And he has a heart issue. And he's hanging on to life by a thread. And he's on the list for a heart transplant. And did not believe, and his doctors agreed, that it was in his best interest to be vaccinated, given the heart swelling concerns and issues, given that of the heart issue that he has. And so is not vaccinated, but is then denied being access to the heart transplant because of some blanket rule about vaccination. This is the politicization that is unfortunate. I go back to my example about the Japan example, which is what I believe the policy of the United States roughly ought to be. I certainly believe in being deferential to our military commanders, make determinations about military readiness, but in broad terms, not when we're talking about this politicized virus. I wish we weren't doing this. I support the ranking member's amendment because I think we ought to be focusing on trying to make sure that, yes, we're having the best healthcare system in the world in the private sector and the VA, but that there's no place for these mandates, which are unnecessary, in which in probably a matter of weeks, certainly a couple of months, the administration is going to be running from as we burn through Omicron. And there's literally, clearly zero basis for a mandate, as opposed to talking about the general efficacy of having been vaccinated when we're talking about the vast majority of adults and healthcare workers having been vaccinated. So with that, I'll yield back, but certainly support the amendment.
Gentleman yields back his time. I'll just point out to Mr. Roy that health exceptions are recognized as valid. And in the case that you mentioned of a severely compromised health of an individual, those exceptions are granted. I now call on Dr. Miller Meeks, Representative Miller Meeks, for 5 minutes.
Thank you, Chair Takano. I speak in favor of this amendment, and I just want to point out when the issue of quality. So not only am I a physician, I'm also a military veteran, and all of the majority of my family members are military veterans, and certainly, like everyone on the Veterans Committee, wish for the highest level of quality of healthcare for our veterans. So when we're speaking about terminating individuals when, as Dr. Ruiz said, 99% of the healthcare workforce in the VA is already vaccinated. And there are individuals who, for a variety of reasons, religious or health reasons, decide not to be vaccinated or could already have immunity and have antibody-proven immunity to COVID-19. We have also had the CDC exempt individuals with COVID-19 because of the healthcare workforce shortage to come back to work after 5 days. And this is also the policy of the VA. So we're talking about quality and saying, if you don't terminate somebody because they're not vaccinated, but if you're vaccinated and you get COVID-19 and you've been ill, we're going to let you come back to work within 5 days if you have a COVID negative test, which could be a rapid antigen test, which could be negative, and a PCR test positive. But yet that's ensuring quality to our veterans to let you come back to work with COVID-19 if you have a negative antigen test after 5 days. I find that to be incongruous and hypocritical. So I support the amendment. I think the amendment is done for valid reasons. I also support the overall concept of the RAISE Act, but it's difficult to support it when other amendments put forth in good faith are wholeheartedly rejected. So thank you very much. I yield back my time.
Thank you, Representative Miller Meeks. Representative Rosendale, you seek recognition. I recognize you for 5 minutes.
Thank you, Mr. Chair. I would yield my time to Ranker Bost.
Yeah, thank you. I thank gentlemen for yielding. And Chairman, just so that we can clear something up, there was a statement that was made, and this is non-controversial. I'm just wanting to get the answer, because as of right now, I talked to the Secretary. The Secretary has let no one go as of yet for any, so they haven't granted or ungranted, but they haven't fired anybody. And when you said that that you believe when Representative Roy mentioned that particular case, that would not be the case. We don't have that promise. We hope that that's the case. We don't have that promise from the Secretary. The Secretary, all of these waivers that have been requested, none have been granted, but nobody's been let loose yet. So I just need to make sure that the committee as a whole and everyone listening to this understands that no one's been let go, but we have no guarantee that that issue will be one that waiver will be approved. And so I just wanted to clarify that. as we move forward. And this is the concerns that are out there. So with that, I'll gladly yield back. Or Mr. Chairman, if you want to comment on that, or.
Well, Ranking Member Bost, I did speak with the secretary. You're correct, 0 employees have been fired up until now. There have been about 35,000 requests for exemptions made. About 2% of those exemptions were medical, of the type that I think would fit the description of Mr. Roy about the heart condition. It's those medical exemptions, if found to be valid, he said would be granted.
Right.
And it is the other types of exemptions which have to be scrutinized. And it's not as if they're going to begin implementing the vaccine mandate next week, but it's not as if we're poised to see thousands of employees, even hundreds or 10 employees dismissed immediately. There is a very negotiated, agreed upon process that they'll be following. So we're not going to see this massive exodus because of this mandate. But I would maintain that the mandate, the hammer of the mandate, it's important for employees to understand that this is serious, and that we've seen when implemented in other companies such as United Airlines and other places that have implemented vaccine mandates, that there is a high degree of compliance. And so this is a you're creating a problem in search of a solution, or I don't know how that phrase goes.
And I thank you. I thank you for the answer. But I don't agree that we're creating a solution in search of a problem, because the problem is there are concerned employees out there that are in this situation. And as you can say, and I can say, that we don't believe the secretary will do it, but we don't know that. These amendments that we're talking about right now would try to cure that and try to make sure that it is the intent of Congress. Now, if you don't support it, that's fine, but that's what the amendments are trying to do. And with that, I yield back.
Thank you, Ranking Member Bost. I see that Mr. Rosendale, Mr. Rosendale, you lose Mr. Bost. I now, if there's no other people, if there are no other members seeking recognition, I will move to a vote on the Bost amendment. All those in favor of the Bost amendment will say aye.
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 Any opposed will say no.
No.
Oh,
No.
In the opinion of the chair, the noes have it, and
Mr.
the
Chairman,
amendment is not agreed to.
Mr. Chairman, I do request roll call.
Is there a sufficient second?
second.
There being a sufficient second pursuant to Committee Rule 4, further proceedings on the amendment shall be postponed. Because further proceedings on HR 5575 have been postponed, we will now proceed to the consideration of the next agenda item, HR 6411. The committee will now proceed to consideration of HR 6411. The clerk will please designate the bill.
HR 6411.
The text was circulated in advance pursuant to committee rules. Without objection, the first reading is dispensed with, and the bill is considered as read and open for amendment at any point. I recognize myself for 5 minutes. This committee, along with our colleagues in the Senate, has advanced 22 bipartisan mental health bills over the past year that now make up the Strong Veterans Act. It addresses gaps all along the spectrum of prevention and care by expanding outreach to traditionally underserved veterans, understanding what approaches are most effective, better equipping VA's workforce to provide care, and strengthening VA's crisis response system. Strong and its component bills are endorsed by too many veteran service organizations and health organizations to list. But let me leave you with this quote from Andrew Marshall, National Commander of Disabled American Veterans. Quote, "There is simply no greater or more urgent challenge within the VA, within the veteran community right now than addressing mental health concerns and ensuring our nation's heroes have access to the support they need to both prevent and mitigate crisis." End quote. Actually, that's not in quote. He continues to say, DAV is pleased to support the Strong Veterans Act, and we urge its swift passage and signing into law, end quote. Now, is there further debate on HR 6411?
Mr. Chairman.
Ranking Member Bost, you're recognized.
Thank you, Mr. Chairman. You know, I was glad to introduce this bill with you last month, and I wanted to thank you for working with me on it. This bill is the accumulation of work that we and our Senate colleagues have been doing since the beginning of Congress to continue our efforts to stop veteran suicide. This bill includes many provisions that have been considered as a standalone bills in either the House or the Senate. There are too many to mention here, but needless to say, the Strong Veterans Act would increase outreach and support to our veterans at risk of suicide, including those who were newly separated from service, who are involved with the criminal justice system, and who are members of the minority population and who are in school. It makes it easier for VA to recruit, retain, train mental health staff. It improves training, responsiveness and quality management at the Veterans Crisis Line. It expands peer support, advances research into PTSD, sleep disorder, substance use disorder, brain health, and more. The Strong Veterans Act is a fully bipartisan bicameral bill. Most importantly, I believe it will help save the lives of vulnerable veterans and improve support for those in crisis for years to come. In addition to Chairman Takano and I am grateful for the work that Chairman Tester and Ranking Member Moran in the Senate that they've done on various pieces of legislation. I'm also grateful to Dr. Murphy, Dr. Miller Meeks, Congressman Elsie, Congressman Rouser, and all the other members and senators on and off the VA committee who have sponsored various provisions in this package. Nonetheless, like I said earlier in this expansive proposal, this is an expensive proposal. I know that my colleagues and I that there's more work to do in the days and weeks ahead to address the cost of this bill and identify high cost provisions that could benefit from redrafting to accomplish these goals through the more cost-effective means. I believe we can get there, and I believe this bill is worth it. The last couple of years, we've have been successful for all of us, but veterans and their families are certainly not immune to that. By reporting the Strong Veterans Act today, we are reaffirming our commitment to helping veterans overcome whatever challenges they may be facing and become healthier and more resilient moving forward. In the meantime, I want to remind veterans who may be listening to this today and feeling helpless that the help is still available. The Veterans Crisis Line is available 24/7 for free confidential support. Remember, you can call 1-800-273-8255 and press 1. That's once again, that's 1-800-273-8255 and press 1, or you can text 833-8255. Once again, text 838-255, or you can visit the Veterans Crisis Hotline or crisisline.net. There's absolutely no shame in asking for help if you need it. And with that, Mr. Chairman, I yield back.
Thank you, Ranking Member Bost. Ms. Brownlee, you seek recognition. I recognize you for 5 minutes.
Thank you, Mr. Chairman. I appreciate a moment to talk a little bit about my bill that's been incorporated into this bill, HR 912, the American Indian and Alaska Native Veterans Mental Health Act. This bill recognizes that Native Americans both serve at disproportionately high rates in the military and unfortunately also die by suicide at disproportionately higher rates. It is critical that VA do even more to reach out to Native veterans with mental health support and suicide prevention. This provision mandates that every VA medical center finally will have a full-time minority veteran coordinator who receives training from VA in the delivery of culturally appropriate mental health and suicide prevention services to American Indian and Alaska Native veterans, especially with respect to the identified populations and tribes within the coordinator's catchment areas. So Minority veteran coordinators must coordinate with suicide prevention coordinators to document and conduct outreach and provide mental health services to Native veterans and will be held accountable by medical center directors. And Mr. Chairman, I also wanted to commend you on your provision in Strong that gives VA the authority to finally treat tribes as equal to states for the purposes of the successful Governor's Challenge program. So I'm just really thrilled to see the explicit support in this package for Native veterans and tribes, and to see these provisions enthusiastically endorsed not only by Native veteran organizations, but also by traditional VSOs and mental health groups. Thank you, Mr. Chairman, and I yield back.
Thank you, Thank you, Chairwoman Brownlee, and thank you for all the work that you've done for our nation's tribes and on this bill. I now recognize Mr. Rosendale. You seek recognition, and I recognize you for 5 minutes.
Thank you so much, Mr. Chair. There's not a single person in this meeting who's not moved by the plight of suffering veterans, in particular, those suffering with wounds that go much deeper than any bullet may reach. Additionally, I don't think there's a single person in this meeting who believes that the American veteran has been well served by an efficient VA. It's not the veteran's fault that we, along with the VA, cannot get our act together to provide them with the care and resources that they deserve. This bill is a rare moment when we in Congress, in both chambers and both parties, have managed to assemble legislation that should bring real substantive improvement for veterans' mental health. But we should not be patting ourselves on the back for merely meeting our expectations. It has taken too long for this body to cobble together bills that comprise this legislation that will put hundreds of millions of dollars into VA programs that have probably needed it for quite some time. But meanwhile, tens of billions of dollars are being directed not to the health of veterans, but to a multinational IT contractor and its electronic boondoggle. We frequently fight about the cost of bills in both human and financial capital, but for some reason, we have continued to allow the VA to funnel billions of dollars, literally an order of magnitude more than the top line cost of Strong, to Cerner and its failed Millennium EHR system. Yes, we allow that to happen because the majority refuses to hold Cerner accountable and stop the wasteful spending. Now, the relevant TechMod hearing is still in the future, but I want you all to think about that. Caring for our veterans costs a lot of money, and good programs deserve that money. Cerner and their failed electronics health record system does not. Thank you, Mr. Chair, and I yield back.
Thank you, Representative Rosendale. Representative Slotkin, you seek recognition. I recognize you for 5 minutes.
Thank you so much. Chairman Takano, Ranking Member Bost, distinguished members of the committee, appreciate the opportunity to highlight some of the bipartisan measures that I'm pleased to support today, which would really go far in reinforcing our commitment to veterans and getting them the care they need. The Strong Veterans Act continues to build on our momentum. And just a couple of weeks ago, you'll remember on the floor of the House, I think most of us on screen voted for the Bipartisan eVest Act in the House, another critical step in simplifying that really key transition process for our veterans when they go from active duty to a veteran status, making sure that they can take advantage of every program available. So the Bipartisan Initiative that we're talking about today is another step in that same direction. It gives the Department of Veterans Affairs and necessary authorities and resources to drive real change. It also includes the Solid Start Act. It's a bill I introduced earlier this Congress and that I introduced to my district in Howell, Michigan, a couple of years ago on Veterans Day. It codifies an existing pilot program at the VA that engages with veterans in their first year of transition. To ensure they're familiar with all the benefits and resources that are coming to them. As we will discuss the bill today, I'm reminded of a particular veteran in my district, Josh. He's an Iraq War veteran from my district, and he told my team that on many occasions, nearly 40% of the Michigans Michigan veterans, are totally unconnected from VA resources that they're entitled to. They just have no idea what they qualify for. This statistic, coupled with our own experience, just traversing the bureaucracy of the VA, or his experience as an active duty member, just trying to understand, just paints the picture of why we need this bill. The benefits and services afforded to our veterans can help with job transitions, education, receiving adequate health care. But all of those things don't matter if no one knows what the heck they're qualified for or what they can get. So I introduced this act with Congressman Joyce. It's a bipartisan bill that takes the next essential step in codifying this pilot program into a permanent program. So it adds to the progress we're all making here in the STRONG Act. And my portion of the bill aims to explicitly engage veterans in that first year of transition. It requires basically the VA to reach out 3 times in that first year after separation to really make an effort to line people up with what they qualify for. It's proactive as opposed to depending on the veteran to sort of seek VA care at some point. And we think it's our responsibility to hold, to honor our veterans by giving them access, giving them the knowledge that they need to access the really good programs that are out there. So I'm proud to support the STRONG Act. I think it'll drive meaningful change and provide life-saving resources in some cases to our veterans who just don't know what they have access to. With that, Mr. Chairman, I yield back.
Thank you, Representative Slotkin. Mr. Allred, you seek recognition. I recognize you for 5 minutes.
Well, thank you, Mr. Chairman, and thank you also to Ranking Member Bost for holding this markup on this vital piece of legislation to improve the mental health care that we provide to our veterans. I want to speak briefly in support of a provision in the Strong Veterans Act that includes the text of a bill I'm co-leading with Reps Scott Peters and Tracy Mann, the Veteran Peer Specialist Act. We have to ensure that every veteran who comes into a VA facility for care leaves feeling supported and heard in their journey with accessing mental health care. In non-VA clinical settings, patients who receive support from peer specialists are more likely to engage with their community and receive treatment. They also report higher satisfaction and quality of life. The VA Mission Act, which became law in 2018, recognized this success and established the Peer Specialist Program as an important support program for veterans across the country. The Veteran Peer Specialist Act expands the successful program to every VA medical center over the next 5 years, prioritizing medical centers in rural areas and requiring that the hiring reflects the racial and ethnic demographics of the veteran population to ensure that all veterans are supported no matter where they live or the color of their skin. As a co-lead on this important bill, I thank the committee for including it in this package, and I urge my fellow committee members to support this critical mental health package, and I yield back.
Thank you, Mr. Allred. And I particularly want to thank you for this section on peer specialists, you and Mr. Peters. I've spoken personally to veterans who have said to me how engaging and how effective peer support specialists can be. And I do believe it's a really fast way for us to diversify our mental health workforce within the VA. Is there any further debate on HR 611? Does any member seek recognition? If not, I'll recognize Ranking Member for a motion.
Mr. Chairman, I move to the committee Mr. Chairman, I move the committee report HR 6411 favorable to the full House of Representatives.
All those in favor of Mr. Bost's motion, please say aye.
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 All those opposed will say. All those opposed will say no. In the opinion of the chair, the ayes have it, and the motion is agreed to.
Mr.
Without
Chair.
objection, the motion to reconsider is laid on the table. Mr. Bost.
Yeah, Mr. Chair, pursuant to House Rule 11, Clause 2, I give notice of intent to file minority or supplemental additional or dissenting views on HR 6411.
Without objection, so ordered. The staff is also, without objection, the staff is authorized to make necessary technical and conforming changes. We'll now move to the unfinished business of the recorded votes, which were postponed. The first item of unfinished business is the recorded vote on the Roy Amendment. The question now occurs on agreeing to the Roy Amendment, to the amendment in the nature of a substitute to HR 5575, on which a recorded vote was ordered. The clerk shall call the roll.
Ms. Brownlee,
No.
Mr. Lamb,
No.
Mr. Levin,
No.
Mr. Pappas,
No.
Ms. Loria, Ms. Loria,
No.
Mr. Mervan,
No.
Mr. Sablon, Mr. Sablon,
Sablon votes no.
Ms. Underwood,
No.
Mr. Allred,
No.
Ms. Frankel,
No.
Mr. Brown, Mr. Brown, Ms. Slotkin,
No.
Mr. Trone,
No.
Ms. Capter,
No.
Dr. Ruiz,
No.
Mr. Gallego, Mr. Gallego,
No.
Mr. Bost, Mr. Bost,
Aye, yes.
Ms. Radewagen, Ms. Radewagen, Mr. Bergman,
Aye.
Mr. Banks,
Yes.
Mr. Roy,
Aye.
Mr. Mann,
Yes.
Mr. Moore,
Yes.
Ms. Mace, Ms. Mace, Mr. Cawthorn, Mr. Cawthorn, Mr. Nels,
Yes.
Mr. Rosendale,
Aye.
Dr. Miller Meeks,
Yes.
Mr. Elzey,
LZI.
Mr. Brown, Ms. Radewagen, Ms. Mace, Mr. Cawthorn, and Mr. Chairman.
Chairman Takano votes no. The clerk shall report the vote.
Mr. Chairman, just a point of order, Mr. Cawthorn is having technical problems, just so you know. I mean, it's not going to affect the vote, but so the chairman knows.
Has he been in contact with our technical support?
We're trying to find that out at this time.
Mr. Chairman, I apologize. I was having technical difficulties. I'd like to record my vote.
How is Mr. Cawthorn's recorded,
Aye.
Madam Clerk?
Mr. Cawthorn votes aye.
Mr. Cawthorn, you're recorded as aye.
Thank you,
Mr. Chairman, based here, how am I recorded?
Madam Clerk, how is Ms. Mace recorded?
Ms. Mace is not recorded.
Ms.
Mace.
Mace, how do you vote? Ms. Mace, you vote aye?
Yes.
Is there any member who wishes to change his or her vote? Well, the clerk shall report the vote.
Mr. Chairman, for this vote, there are 12 ayes and 16 noes.
The amendment is not agreed to, and without objection, the motion to reconsider is laid on the table. Question now occurs on agreeing to the Bost amendment to the amendment in nature of a substitute to HR 5575, on which a recorded vote was ordered. The clerk shall call the roll.
Ms. Brownlee,
No.
Mr. Lamb,
No.
Mr. Levin,
No.
Mr. Pappas,
No.
Ms. Loria,
No.
Mr. Mervan, Mr. Mervan, Mr. Sablon, Mr. Sablon, Ms. Underwood,
No.
Mr. Allred,
No.
Ms. Frankel,
No.
Mr. Brown, Mr. Brown, Ms. Slotkin,
No.
Mr. Trone,
No.
Ms. Capter,
No.
Dr. Ruiz, Dr. Ruiz,
No.
Mr. Gallego, Mr. Gallego,
No.
Mr. Bost, Mr. Bost,
Aye.
Ms. Radwagon, Ms. Radwagon, Mr. Bergman,
Aye.
Mr. Banks,
Yes.
Mr. Roy,
Aye.
Mr. Mann,
Aye.
Mr. Moore,
Aye.
Ms. Mace,
Mace, aye.
Mr. Cawthorn, Mr. Cawthorn, Mr. Nels,
Aye.
Cawthorn
Mr.
votes aye.
Cawthorn votes aye. Mr. Rosendale,
Aye.
Dr. Miller Meeks,
Aye.
Mr. Elzey,
LZI.
Mr. Mervan, Mr. Sablon,
Mr. Mervan votes aye.
Mr. Mervan,
No. Mr. Mervan votes no. Correction.
Mr. Mervan votes no. Mr. Sablon, Mr. Brown, Ms. Radwagon, and Mr. Chairman.
Chairman Takano votes no. Are there any members who wish to change?
Yeah, how did Sablon vote?
Madam Clerk, how did Mr. Sablon vote?
Mr. Sablon is not recorded.
Sablon votes no. Oh, is this on the main bill?
No, this is on the amendment. The
Sablon
Bost
votes
amendment.
no.
Yes. Thank you, Mr. Sablon. Are there any other members who wish to be recorded? Any members who wish to change their vote? Madam Clerk, please report the vote.
Mr. Chairman, for this vote, there are 12 ayes and 16 noes.
The amendment is not agreed to. And without objection, the motion to reconsider is laid on the table. Is there any further debate on or amendment to the Underwood Amendment in nature of a substitute to HR 5575? If not, the question is on the Underwood Amendment in nature of a substitute to HR 55. All those in favor will say aye.
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 Aye. All those opposed will say no.
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 In opinion of the chair, the ayes have it, and the Underwood Amendment in the nature of a substitute is agreed to. Without objection, the motion to reconsider is laid on the table.
Mr. Chairman, I was requesting a roll call vote.
There is a request for a roll call vote. Is there a sufficient second?
Second.
Second.
There is a sufficient second. A roll call vote is ordered on agreeing to the amendment in the nature of a substitute, and the clerk will call the roll.
Ms. Brownlee,
Aye.
Mr. Lamb,
Yes.
Mr. Levin,
Yes.
Mr. Pappas,
Aye.
Ms. Loria, Ms. Loria,
Aye.
Mr. Mervan,
Aye.
Mr. Sablon,
Aye.
Ms. Underwood,
Aye.
Mr. Allred,
Aye.
Ms. Frankel,
Aye.
Mr. Brown, Mr. Brown, Ms. Slotkin,
Aye.
Mr. Trone,
Aye.
Ms. Capter,
Aye.
Dr. Ruiz, Dr.
Aye.
Ruiz,
Aye.
Mr. Gallego,
Aye.
Mr. Bost,
No.
Ms. Radwagon, Ms. Radwagon, Mr. Bergman,
Aye.
Mr. Banks,
No.
Mr. Roy,
No.
Mr. Mann,
No.
Mr. Moore,
No.
Ms. Mace,
Mace, aye.
Mr. Cawthorn,
Cawthorn aye.
Mr. Nels,
No.
Mr. Rosendale,
No.
Dr. Miller Meeks,
Aye.
Mr. Elzey,
LZ nay.
Mr. Brown, Ms. Radewagen, and Mr. Chairman.
Chairman Takano votes aye.
Mr. Chairman, may I request how I'm recorded?
Madam Clerk, how is Mr. Cawthorn recorded?
Mr. Cawthorn is recorded as aye.
Madam Clerk, I'd like to change my vote to no.
Does any member wish to change his or her vote? Are there any other members who are need to be recorded? Madam Clerk, please report the vote.
Mr. Chairman, for this vote, there are 19 ayes and 9 noes.
The amendment in the nature of a substitute is agreed to. Without objection, the motion to reconsider is laid on the table. I now recognize
Mr. Chairman,
Mr. Ranking Member Bost.
pursuant to House Rule 11, Clause 2, I give notice of intent to file minority or supplemental additional and or dissenting views on HR 5575 as amended.
Mr. Bost, would you please make this request after?
Yes,
the vote?
that was.
I'm happy to
earlier.
accommodate you, but he's kind of jumped the gun a little bit.
All right.
All right. I now recognize Vice Chairman Levin for a motion.
Mr. Chairman, I move that HR 5575 as amended be reported favorably to the House.
All those in favor say aye.
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 All those opposed will say no.
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 In the opinion of the chair, the ayes have it. The motion is agreed to. Without objection, the motion to reconsider is laid on the table.
Mr. Chairman,
Ranking Member Bost.
not to be redundant, Mr. Chairman, in pursuant to House Rule 11, Clause 2, I give notice. You want to? Mr. Chairman, I asked that we do a roll call vote. I apologize.
You were not redundant, Mr. Bost.
So I don't want to.
Well, you were redundant, but you weren't redundant. There is a request for a roll call vote. Is there a sufficient second? There is a sufficient second. A roll call vote is ordered on the motion to report HR 5575 as amended. The clerk will call the roll.
Ms. Brownlee,
Aye.
Mr. Lamb,
Yes.
Mr. Levin,
Yes.
Mr. Pappas,
Aye.
Ms. Loria,
Aye.
Mr. Mervan,
Aye.
Mr. Sablon,
Aye.
Ms. Underwood,
Aye.
Mr. Allred,
Aye.
Ms. Frankel,
Aye.
Mr. Brown, Mr. Brown, Ms. Slotkin, Ms. Slotkin,
Yes.
Mr. Trone,
Yes.
Ms. Capter, Ms. Capter, Dr. Ruiz, Dr. Ruiz,
Aye.
Mr. Gallego,
Aye.
Mr. Bost,
No.
Ms. Radewagen, Ms. Radewagen, Mr. Bergman,
Aye.
Mr. Banks,
No.
Mr. Roy,
No.
Mr. Mann,
No.
Mr. Moore,
No.
Ms. Mace,
Mace, no.
Mr. Cawthorn,
Cawthorn votes no.
Mr. Nels,
No.
Mr. Rosendale,
No.
Dr. Miller Meeks,
Aye.
Mr. Elzey,
LZ nay.
Mr. Brown, Ms. Capter,
Aye, can you hear me?
Capter votes aye.
Okay.
Ms. Radewagen, and Mr. Chairman,
Chairman Takano votes aye. Clerk will report the vote.
Mr. Chairman, for this vote, there are 18 ayes and 10 noes.
The motion is agreed to. Without objection, the motion to reconsider is laid on the table.
Mr. Chairman,
Ranking Member Bost.
Pursuant to House Rule 11, Clause 2, I give notice of intent to file minority or supplemental, additional, and/or dissenting views on HR 5575 as amended.
Without objection, so ordered. So without objection, staff is authorized to make necessary technical and conforming changes. This concludes the business of the markup. I'm glad we were able to pass 2 bills today to support our nation's veterans and the talented healthcare workers who care for them. I am very proud that we have advanced Representative Underwood's legislation to help VA competitively recruit and retain experienced nurses and physician assistants in high cost of living markets. A key way that we can help ensure our veterans receive the world-class healthcare that they deserve. We also advanced my legislation with Ranking Member Bost to bolster VA's efforts to reduce veteran suicide through increased training, outreach, mental health care delivery, and research. As the COVID-19 pandemic continues, we remain committed to making sure that all veterans can access VA's life-saving measures and life-saving resources. Does the Ranking Member or any member wish to be recognized before we adjourn?
Yes, Mr. Chairman, thank you. I'm proud of the work we did on passing the Strong Veterans Act today, and I look forward to continuing to work with you and the colleagues to address its high cost and send it to the president's desk as soon as possible. I regret that we were unable to find a way to work together on supporting all VA nurses and PAs even though those who perform life-saving work for veterans, but their own valid reasons for not getting the vaccine against COVID-19. That being said, I do appreciate all of the hardworking men and women and believe they deserve our help and in every aspect while working at our VAs. But I do appreciate the opportunity for the debate today, for the input of all members. And with that, I yield back.
Thank you, Ranking Member Bost. The proceedings are now over and we now are adjourned.